My name is Agnes Achola. I am Assistant Nursing Officer Midwifery working at Moto Regional Referral Hospital. I want to thank God for RIWE Africa with partnering with Laerdal Foundation for having identified Karamoja, most especially Moroto District and Napak, as one of the districts to help and try to reduce the maternal and neonatal mortality rate that has been so high. I was among the facilitators who trained the midwives and VHTs. I took up the concept of helping mothers survive, where it was an interesting lesson with my participants. You realize that RIWE Africa, its goal, it is to reduce maternal neonatal mortality in these pastoral districts, especially this Moroto and Napak. We appreciate their efforts. We really appreciate the efforts RIWE has put into Moroto as a district to empower us, the cattle keepers, and we really need to have a good life, that when a mother delivers, no mother must die. In helping mothers survive, we have components like safe birth, where we empowered our midwives and VHTs to master the components of safe birth so that they are able to identify all pregnant mothers in their communities, refer them, encourage them to attend antenatal, encourage them to seek help maybe during postnatal in case they have anything that is not right with them. They should come to a skilled birth attendant and have birth. No mother must die while giving birth. It is painful, just only one mother to die like this, the country loses. So the project is bridging the birth gap in Karamoja.
So helping babies breathe is our focus, to make sure that the lives of babies is alive and is able to breathe. So how we implement this is by equipping knowledge and skills to the midwives across the different health facilities in the region. So when a baby is born, we make sure that that first minute is a golden minute and the baby is able to breathe. So immediately the baby is born, the midwife quickly assesses the score or the level of activeness of this baby. But if the baby scores moderately, we go on and stimulate the baby and wrap them under warm clothing, which is in most cases cotton, and then after attach them to the mother's abdomen and implement the skin-to-skin mode of contact, which is done immediately after birth. After that, if the baby is not severely asphyxiated, by then when we do that and do the suctioning and the stimulation, we expect those babies to breathe. But there are these babies, specific cases where babies are severely asphyxiated, where you find they score like a 3 or a 2, and you have to go on and do the bagging and masking and the ventilation. Sometimes you still go on and administer these babies on oxygen. So we are trying to support the communities and the midwives. We equip them with knowledge and the skills, and then know when and where to refer the baby for proper management.
To add on that, is what they call a face tracker, facility and community encounter. So that too, it is software app which is installed on the phone, whereby first I want to appreciate that they have procured phones to all our VHTs who were identified in this particular specific sub-counties. We want to say that initiative is very, very good. It's going to improve on our referral system. It's going to improve on our communication between the community and the facility. When a VHT identifies a mother with any risk or anything that needs to be attended to in the facility, through that tracker, you realize that the midwife at the facility is able to get the notification there and then, because they have already provided the phones. Now they're going to provide laptops to the facility, where the midwife will be in position to get an alert that there is a mother ABC who is going to be referred from village in Kalemole to Kalemole Health Center 3. So you realize that as a midwife there, she gets an alert and she is able to prepare. And in that way, they are saving and reducing the chances of losing that patient, whether it is a baby or mother. She's able to prepare because she knows the mother who is coming has PPH. Maybe the mother who is coming has had a rupture of membrane. So you as a midwife who is at a facility with this system, she is in position to prepare early and then reduce risks of delays, which later result to deaths.
This morning as RIWE Africa, we are here trying to have a concerted effort in supporting our mothers survive during and after delivery, and also support our babies breathe. So we need to strengthen the community referral pathway. So as an effort to join hands with the health center within this community to ensure that the referrals are complete and our mothers are getting an on-time service delivery, we have come up as RIWE Africa to support the facility with a computer, where one of the midwives, who is the focal person for the project, will be receiving referrals and of course making timely follow-up for these mothers and timely service delivery. In that way we shall be able to bridge the birth gap. So I have the honor to hand over this computer to the district health officer for Moroto district as an act of partnership together with us. And with that also we are giving the DHO funds which is going to be giving to the VHTs to support them collect timely data from the community. We are honored to partner with your DHO.
Thank you very much. Yeah, I'm Dr. Lemcol James, the District Health Officer Moroto. This morning we are honored as the Moroto District Local Government to receive this very precious, essential and effective support that is going to really make a significant improvement in availability, access, utilization, and also hopefully the quality of maternal child health and safe delivery for most of our mothers in this part of our district, and specifically in Karamoja Health Center 3. I am honored to receive this equipment from RIWE Africa and also the smartphones for the VHTs. This is a very unique support in kind, and it is going to make a very significant difference and remarkable improvement. So I am therefore honored to hand over this equipment to the in charge of the health facility. And we hope that you will make the best use of this, and our VHTs will hopefully play a very significant role in doing what is expected of them, to mobilize the communities and also support us in the referral of our mothers.
Oruka